Don't look now, but it's a whole new world of weed out there. Pot is flower, it's Bruce Banner and Blue Dream. You've got bongs and dabs, resin and shatter, vaping and edibles, new terms, new strains, and new ways to use cannabis sativa, the plant. Some just made with CBD, and hemp has minimal THC. There's sativa and indica strains, and 100 chemicals, all legal in 10 states for adult use. There's a lot to get to know. Get used to it, folks, because it's legal in the Bay State and it's not going away. Neither is In the Weeds with Jimmy Young next. Revolutionary Clinics is just one of 49 medical cannabis dispensaries in Massachusetts, but there's a reason why it's one of the most popular. It's their patient-first philosophy. All day long, they teach, they educate, they communicate about this complicated plant called cannabis sativa. That's true whether you visit their Cambridge location in Fresh Pond at 110 Fawcett Street or at 67 Broadway in Somerville. Revolutionary Clinics, where the patient comes first. Welcome to the Performer TV studio in Quincy, Massachusetts. I'm Jimmy Young, the host of In the Weeds for this special live edition. And we welcome in two very special guests, Dr. Marion McNabb and Dr. Stephen Mandile. Doctor, congratulations, Dr. Stephen Mandile. Did you know you got an honorary degree from the Pro Cannabis Media Institute?
What an honor.
I knew you'd be happy about that.
I'd like to thank my parents.
The Academy, right?
Yeah.
For those of you who don't know these people, or even myself, Pro Cannabis Media is a pro cannabis media site, and we are dedicated to telling the stories of the cannabis industry through their own words. Two people in studio right now, Dr. Marion McNabb and Stephen Mandile, have been at the forefront of cannabis advocacy in Massachusetts over the last umpteen years. How's that? Is that fair enough? Umpteen? That's one of those.
It's fair.
That's fair?
Yes.
Adding a decade or so.
But Dr. Marion McNabb from the Cannabis Community Care Research Network, we call it C3RN just because it's easier to do it that way, right? And Stephen Mandile is a veteran. He was in Iraq. He got injured. He came back. He went to the VA. They put him on 17 medications. He kicked them all through cannabis. Is that accurate?
After the total of everything after the decade, it was 57 medications.
Oh, excuse me.
It's okay.
Between 1 and 5, you know.
What's 40 medications?
What's 40 medications? Stephen, your story really is compelling, I might add. And I also understand that, are you now a selectman?
Yes, I am.
Well, congratulations.
Thank you very much.
And it's in Uxbridge, Massachusetts.
Yes, it is.
Which is where Caroline's is.
Yes, home of the first woman-owned dispensary in Massachusetts and home to the first microgrow license in Massachusetts as well.
Very cool. And I've been out to Uxbridge, actually lived in the tiny town of Mendon for a little while.
The tiny town of Mendon,
which is right next to Uxbridge.
Yep.
It's the whole western metro, metropolis out there, I guess. So
yeah, it's a hub.
It is a hub. And Dr. Marion McNabb, can I just call you Marion?
Of course.
Thank goodness. And step in a little closer to your microphone so that we can actually hear you.
There you go.
Appreciate it. Tell us a little bit about your Cannabis Advancement Series. And I understand there's another event coming up August 22nd?
Yes.
On the North Shore.
Yes, and I'm glad you have this here.
Yes.
Really exciting. So the Cannabis Advancement Series is a product of work that Steve came to C3RN in December last year, asking to see if we can look at implementing a research study for veterans and their health and medical cannabis. Out of that, a Cannabis Advancement Series was born, which is our educational series around the data that is collected through this research study. We're on our fourth event now. It's a collaboration between C3RN, Steve, Veterans Alternative Healing, and Joint Venture & Co. and Brum. And so we've all come together as a partnership to run an event series that really tries to bring together leaders in the industry, thought leaders, policymakers, community members, veterans, citizens, scientists, academics, to really engage on how do we bring this industry here to the next level in a thoughtful, professional, and academic way. So we've had 3 events so far this year. Our next one is on August 22nd in Lynn, Massachusetts.
Yes.
Yeah,
that was my dad's
am.
hometown and where my broadcast career began.
Oh, wow.
At WLYN in 1979. It was the first talk show that I ever hosted back then. It was called Sports Call, of all things. What a shock, right?
Right.
And I'm going to tell you, you may even remember the first guest I had. You weren't listening, I know. But do you remember Randy Vataha?
I don't. I was 2 in 1979.
I know, but he played football for the Patriots. He played football for
wasn't playing.
Stanford. He used to catch passes from Jim Plunkett. Doesn't matter. Anyway, somebody out there's my age will remember Randy Vataha. That's all I get. And by the way, he's about your size, Marion, by the way. Just saying. No disrespect. Here's the thing about cannabis and what I've learned over the first year of this operation that I've been doing this podcast is science and research is leading this green wave of the movement towards decriminalization, descheduling, and proper respect for the cannabis plant. Right?
I would say there's a room and a growing group of academics and scientists, but I think the people are really leading the way as well. Advocates, community members, not just limited to scientists and researchers. I think scientists and researchers have been limited in the last many decades from what they can study around cannabis and the funding available or the resources or the pathway to be able to research cannabis well. So it's really prohibited a lot of academics from being able to meaningfully study it. Now that it's legal here in Massachusetts, there's a research license category. It's part of everyday life. Now I think we have more of an opportunity. But in terms of those that are really leading the way for decriminalization or fighting for rights, I think over and over we often see it's the advocates who really are pushing change, including my colleague Steve.
Yeah, the research and the data, that's like the sword and the shield for advancement. Like we need those tools to finish the mission. You're going up against the old propaganda and stigma that was put out there, and just people accepted that. Well, these numbers that we're collecting now are the answers to the questions of, well, why isn't it legal? And it's always, we don't have the data, or it's this or it's that, and without any proof. So now it's like, well, here's the proof, here's some stories, and here's the numbers to back up what we're saying. That's on a much larger scale than you're thinking it is.
Exactly. And I think one of the most important parts of our study that we've been working on is the local nature of it. Just I guess to give the audience a little bit of background, we launched the Veterans Health and Medical Cannabis Research Study together with UMass Dartmouth on March 3rd this year, which was the launch of our Cannabis Advancement Series. It's a study that is fully anonymous, and it's for any U.S. veteran to take, so we don't collect any identifying information, IP address, etc. And what we're doing is asking veterans to share their current medical status, what health conditions they're facing, what their conventional treatments are, if they consume cannabis, either recreationally or medically. You don't have to consume cannabis as a veteran to take the survey. And then if you consume cannabis medically, then we ask for what health conditions they're most helpful for and symptoms. And then we drill down into stigma and education. So around family acceptance, health provider acceptance, and access issues. So I think we really are intending to use this information and this data, anonymous information and data, to really drive change at the local level. And what we find, we're focused on Massachusetts here. Massachusetts veterans are, 3 times more likely to die of an opioid overdose, higher than the national average of veterans and the general population. And there's a suicide epidemic that is of great proportions. So among the veteran population, 22 suicides a day. So what we intend to do with our event series and the Cannabis Advancement Series and our research study is at every event, we're trying to use some of this information to drive policy change at the local level, meaning a city or town or wherever we're at, and trying to understand within Massachusetts, it's its own commonwealth. There's 351, different cities and towns. So it's a complex place. So anyway, trying to use this data to drive change at those local levels and bring access.
And we're finding one of the great things about this, we're finding that for so many different issues, injuries, disabilities, of why they're taking the medicine, how they're taking it, and also which medications that they're able to reduce or stop taking, being able to use cannabis. And just due to side effect reasons, it's just great to be sharing that information with everyone. We're capturing all this data, all this information from the veteran community, but it's really a snapshot of the greater picture of, people, just the United States, with all the different conditions, all the different injuries, mental, physical, both ways. And really coming up with choices, alternatives to, in between, because we were talking about this earlier. You're going from ibuprofen to OxyContin. There's so much room in between there.
There's a big jump right there. I just want to say, right?
It's a huge jump. So how about, you gradually get to that, which was initially created as like an end of life pain reliever or any other medication that it replaces. There's always that room. And with our event series, we're able to talk to local, whatever area we're in, and we focus on issues relevant. We did the opioid epidemic in Worcester. We did entrepreneurship in Holyoke. We started off with healthcare across the lifespan of the human being in Boston. And we're just focusing on the things. So it's not for, it's for everyone. We're not leaving out anybody, whether you have been in the cannabis realm for decades or you're thinking about if you want to learn. It's the perfect place to go. We're not stigmatizing. It's just shared knowledge. You're hearing from industry experts, whether it be professional in the business or physicians. So it's all around. It's free, exactly.
Yeah. And that's the idea, isn't it, with the VA, to be able to get access to free medication and free health care, supposedly, right, Stephen?
That's the vision. Is this ends up, the VA does what they promised us when we promised to go over to fight these wars and being able to take care of us. So to be able to have the VA supplying veterans with what they need, even if it's cannabis, is what we want to see. But in the meantime, where it's not federally there yet, Massachusetts, we're there. We can do it. We can start now. We can set up something for our state to take care of veterans while the VA figures itself out and things move forward there with the DEA and everything else.
Yeah. And in the world of change down in Washington, D.C., there's so many bills going through the legislature right now, whether it be the States Act or the Safe Banking Act. But to me, one of the easiest things I think everybody should understand is, can't we help our veterans have access to medicinal marijuana? I mean, isn't that
it's low-hanging fruit, like every legislator that can do something will come out looking like they're helping veterans, because it's exactly what they're doing. It doesn't seem like rocket science, but
you haven't gotten it done yet, right? And same thing with the banking. They're still in the cash economy. Right. It makes absolutely no sense. They're trying, and hopefully later on in this show we do have a guest planned on the phone. And again, this is the first time we've been in this studio, and Lord knows we're learning lots about visual radio and all the challenges. And again, we're talking to Dr. Marion McNabb and Stephen Mandile. So we are going to talk to Morgan Fox, who is the Media Relations Director down at the NCIA, the lobbyist group that's down in D.C. I've never seen people work so hard. I went down there in May, and they're meeting with everybody and taking walks with everybody. I mean, lobbying is just kind of sharing information and leading with science and research just to get this needle moved a little bit and get the respect that the industry has been craving for a while. And everybody, it's really interesting. Everybody kind of agrees that, the time has come to make this, decriminalize this thing, get this off our books and take the people who have been hurt the most by the failed war on drugs, give them a chance to get a hold of the weed pie, is what I call it, the weed pie. Marion, you read, I'm sure you do, all the different research and all the different studies out there. There was one recently that came out about Colorado and use by youth in Colorado. And they're actually finding now that usage by our youth is going down in legal states.
Yep.
And you guys are smiling because this is kind of like volleyball, where I kind of lay it up for you guys, right? And I didn't mean to hit the microphone. Like I said, it's a new studio. I don't know where anything is. So tell us a little bit about what that study means moving forward.
Yeah, the reason why I'm smiling is that yesterday Steve was aired on PBS Live NewsHour, and that study was the last slide on that video that was aired last night. So I would encourage folks to check out that
Can I go back to that a second? Did they explain why it was the last slide? Just out of curiosity?
They didn't, but if you look at the narrative of their story, you could understand why they wanted, it was a very balanced approach to a lot of science right now in the cannabis industry is right and left wing, right? Mm-hmm. So it's very hard it's a pendulum swing. So anyway, they were doing a really good job at balancing. Right. And so anyway, that was the last slide. That's why I smiled. I think a lot of things about youth prevention. So I think, right now, at least in the Cannabis Control Commission and in Massachusetts, I feel like the state has a legislative mandate and has done a really good job of designing a public health prevention campaign, approach, messaging system to ensure that young people don't have access to cannabis. Also, that there's appropriate labeling, age restriction requirements. I think, the state here has done a very good job of implementing a public health campaign. So while we see, Colorado youth rates go down, they've implemented approaches that, reduce youth access. I think Massachusetts will do the same. Mm-hmm. And they already have. I mean, we can see great billboards around that are, really promoting like a legal, safe environment here.
Right. Use it responsibly. Again, I keep preaching this on my podcast on a regular basis, that it's an adult use product that is expected to be used responsibly, both recreationally and medicinally.
Absolutely.
Right.
Absolutely. And I think it's really important to remember that, and I believe that you're going to have a colleague and a friend, a pediatrician on this show.
Dr. Eric Ruby is going to be coming.
Dr. Eric Ruby. I think it's really important to remember that, there is a lot of evidence and emerging evidence coming out around pediatric uses of medicinal cannabis. So anything from cancers and autism. There's a lot of science going on in Israel around this as well, a lot of clinical research. So I think it's important to focus on a pediatric population also. So while we want to ensure youth prevention, we need to make sure that that's balanced messaging, that it's not the new dare. It's this is responsible, but it's also a medicine, and be aware that children will need this in school medicinally. And I believe maybe Steve, or maybe Colorado somewhere recently, just one school started to allow pediatric medicinal cannabis use. And I think it's really, really important. I'll be a little provocative because I also think it's important because a lot of our young people take medications that are much stronger and mind altering in some instances than cannabis. And so I think just being aware of a balanced public health approach that ensures prevention while access is an important one.
And this is what I tell parents whenever they ask me, you want to, talk to your kids about all the adult use products that are out there. To me, this is a great excuse, a great time to say, look, this is cannabis, this is alcohol, this is caffeine.
Yep.
Okay, and I had
normalize it.
Normalize it?
Right.
Well, educate yourself about these products.
Yeah.
More than anything else. And parents always say, "Oh, it's difficult to talk to my kids about sex, drugs, and rock and roll." It really is what it comes down to. And I said, "Well, guess what? You were a kid once. Think about what you were going through when you were being pushed or pressured by your friends to, hey, just try this." And here's my thing that really gets me mad. Okay, a lot of things get me mad. But our youth today, when they do go after alcohol and start experimenting with alcohol, they're drinking to get drunk. They are drinking in excess to the point where you could die by having too much alcohol, especially when it might be the first time your system is dealing with it, right? To me, that is more of a danger than any cannabis drug at any concentrate, at any level. I don't care. Yeah. Right? I mean, this is what bothers me.
Yep, it's the parent's job to talk to your child about it. I mean, if communication is the problem for you, you're going to leave it up to the alternative that they're going to learn about these things through institutions like your school and what their beliefs are, or out on the streets. I mean, I learned a little bit from there, but it's hit or miss when you learn it on the streets. But but just to say that anything that comes without risks is careless. So you go through them all, and then you're like, okay, and cannabis is a form of harm reduction if you're talking about alcohol, if you're talking about these other stimulants for conditions like ADHD, even the stomach issues that some children have. So to say that it's absolute without any negatives from it is careless. But to then put it into those other boxes with everything else, like they complain about it being so bad, but they put the same messaging for the alcohol warnings as they do on the cannabis warnings, and then they complain that it's not bad enough because it doesn't mention psychosis, and it's like alcohol causes psychosis too, and if you don't put it on there, it's this double standard of, well, we don't know what to do with it, so let's just keep it hidden. And it's like, that's not where anything's gonna any progress is gonna be made with it. So
absolutely. And some of the, in our first study that was a predecessor to our veteran study, we also asked this data point in our current veteran study, which I'll look into now. One of the striking findings we found, we launched an open cannabis consumer and patient study, also anonymous, last year, and we asked the question, are you how are you using cannabis within your life?
What is your cannabis history?
Yeah, like how are you using cannabis in your life? And strikingly, we found that many were using cannabis to reduce their use of alcohol, they reduced their use of cigarettes, and actually serving in data form exactly what Steve said as a harm reduction strategy. So that, and strikingly in our study for veterans, 63% of our most recent data release of the veterans who took our study reporting consuming medical cannabis are using it to reduce the use of prescription medication intake. Right. So we all know that addiction and alcoholism, addiction, pills, they're all complex issues. So if we're seeing that cannabis is, serving as a positive substitute or alternative for some of these other harmful substances or unwanted prescription medications, you're reducing, cocktails or the ability to, I just think that there's definitely a need for more inquiry around it. I'm not saying that this is a silver bullet or, anything. It's a tool in the toolkit that I think clinicians and academics and healthcare providers and patients all could benefit from.
And it's proving to be a pathway to a better quality of life, which is the most important thing overall.
Absolutely.
Right. We do have a clip that I'm going to set up a little bit. You guys remember Johnny Carson. Anyway, that is your interview with Dr. Lester Greenspoon.
Oh,
right?
awesome.
Yep.
And it's a great little clip. It's a couple of minutes long because the guy's 90 years old. Now, first of all, tell us who he is and what his reputation is a little bit, guys. And then I'll cue it to our technical director and the guy who's putting this all together, Mike Zodos, and he'll play it. But it's a funny story about his first time use of cannabis with a very interesting personality. So first of all, set up who's Dr. Lester.
Well, I'm going to let Steve do it.
All right. So Dr. Lester Greenspoon is, the godfather, I think, of where cannabis came from to today, and that he was someone that was an academic that was sure that cannabis was bad for us, was positive. There's nothing good about it.
Yeah.
And
He's
then
at Harvard.
Right, at Harvard, and through his family, through his friends, was proven that he was wrong, and is such a great man that he came around to the other side and started working the other side to find the truth, and has helped cannabis move light years ahead. Was one of the early on families needing it for medical uses for a child, and it's just an amazing story. The whole family's just been so helpful. I've met his son Peter, Dr. Peter Greenspoon, 3 years back when I first started my recovery, and being able to read Peter's book about his opioid addiction, and he was able to make me feel like I wasn't just someone oddball with addiction, that it was going across every, to say a doctor come out and say that he had a problem with addiction is incredible. So it's just an amazing family, and we'll get right into it. He's awesome.
Let's roll this. Let's roll the clip, Mike, and listen to. He's 90 years old now, right?
Yes.
All right. It was Dr. Marion McNabb's interview with Dr. Lester Greenspoon.
Well, it was Carl Sagan and I were the closest of friends, and it was right up until the day of his death. We were each other's closest friend, but very shortly after I met him, we were invited to his apartment, and he lit up a marijuana cigarette.
A marijuana cigarette.
Here I was, a psychiatrist whose interest was in psychopharmacology, and I was a kind of I wasn't an expert, but I was supposed to know about those things. And I said to him, "Carl, you mustn't do that." "Why not?" He said to me, and I said, "Because it will harm your health." And he took another puff, and he said, "Here, Lester, have one. I can assure you it won't harm your health." And I had the greatest respect for Carl, and I felt, I had to take that seriously. I think he's wrong, but I've got to give him the data to prove it. He's got to see the data.
Yeah.
He has to see the data. So I went to the Conway Library, and I was going to read some things on cannabis, but I became so involved. I found it so interesting. I don't believe there's a publication in Conway Library that touches on cannabis that I didn't read at that time.
Would that be the first systematic literature review on cannabis? Literature?
Well, it may be. I can't make that claim, but it was the first systematic review for me.
Yeah.
And that's how I became interested in this, and I could be reassured that my friend Carl wasn't harming himself.
So that was his first experience with cannabis, and he shared a joint with Carl Sagan. I mean, that's pretty cool, right?
Yeah, that's really cool.
Yep.
Yeah, it was a pretty incredible experience.
Do you know how old he was at that point?
Oh,
he had to be in his 30s, right?
I don't remember the exact age.
I would have loved to have been a fly on the wall for those conversations during those sessions with Lester Grinspoon and Carl Sagan.
Yeah.
Pretty
amazing.
Right,
pretty
interdimensional
amazing.
travel, all that.
Yeah.
Just amazing stuff.
Wow.
But
yeah, Dr. Grinspoon obviously is an academic hero. So he basically, at Harvard, tried to challenge the prohibitionist movement through academic inquiry.
But not just Harvard. It was President Nixon.
And presidential levels. He wrote the first book, Marijuana Reconsidered, several after that, challenged the ivory towers around the value of studying cannabis illegally. It's like I mentioned before, it's very difficult to study cannabis as a researcher, and it's federally illegal. So his sort of leadership in taking that torch to continue to fight for ethical scientific inquiry is just, a model for all, and got to give that up to Sue Sisley too. Right. But it was really, really incredible to be able to meet him, and thank you, Steve, for kind of making that happen. And he, it's just one of the most striking points of that interview for me is a lot of the community around. He never received professorship, which is a really large deal, and he's published, hundreds of publications. So for an academic to not receive your professorship is significant. So a lot in the community over the last couple of years challenged Harvard around, doing that, and he's fought in his own career. But when I asked him about it, he said, I really don't care at this point, because he knows the work that he did made an impact on the community and really fought for legalization. And it was so powerful to hear it from his own mouth. And like academics, they can have egos, and it was just an incredible moment.
Yep. Yeah. I mean, I've been fortunate where I've had the opportunity to meet Dr. Grinspoon. I've also had the opportunity to meet the late Dennis Prone in San Francisco. Met Marvin Gilmore also in Boston. So I'm learning from all these leaders, the pioneers that were doing it back when, veterans were getting spit on, all this stuff, and they fought and they never gave up. And that was like that's the main thing I've learned from them, and I want to share all of my experiences with these opportunities with other people that I work with, because it really drives you to see, like, these people, you were setting off, you started off on a task that everyone told you wasn't possible, but they never gave up. They had doors slammed in their face, they locked up, thrown in jail, still never gave up. So it's just that idea that you have to keep going, and that's where we are with our series. And the cannabis, it's called Cannabis Advancement. We want to advance everything forward, keep it going, and our focus to be able to do things for veterans is to show that it can be done. If you really want to do something, send in the door kickers first, and that's what we are. So, but what we need from the community at large, society, is for, if you really want to help a veteran, it takes a little more than a thank you. It takes more than, doing push-ups and stuff like that. We need the action of the people. It's proven time and time again that it's the people that when they speak, legislators listen. So we need more action. We need more than thanks. Coming and calling your legislators, coming to these events, sharing your stories, opening up with people, and really activating your government to do its job and to say, we've had enough of this. 20 to 22 a day. We're not going to stand for that, especially when there's something in the toolbox, like you're saying, that we can pull up and help now. Will it be the end all, the magic bullet? No. But again, it's harm reduction. It's allowing veterans to have a family life again. It's allowing families to move forward. It's allowing them to work. Just recently, last month, a veteran was denied a home loan, his VA home loan, because he was a manager at a dispensary. They changed that this week. It's changed that change that can no longer keep you from getting a loan.
Wow.
That's
great. Right?
That's progress.
Right.
We can give a big round of applause for that, too.
Yep.
Now, if we can get the employers to not
Exactly.
fire employees for using cannabis on their own time
Right.
and not affecting their job performance, we'll really have made progress.
2 years ago, I wrote a policy paper about that to support workers' rights around that, both if you're a medical card holder or not. So
look,
I could read.
It sounds something like what you would read from another country.
Right.
Yeah.
Where people don't have rights. It's like, no, your job gets to tell you what medicine you can and cannot take.
Yeah,
Right.
it's not fair.
It doesn't sound like America, but
That's
here
right.
we are.
Well, yes. Well, let's get it. We can certainly be talking about that as well. Guys, look, I firstly want to thank you for coming in today. You're friends, good friends, getting closer and closer. This is a historic time. We're all in it together. You guys know I'm dedicated to keep telling the stories of people like Stephen and you, Marion, everything that you've done for this cause. I'm going to continue to wave the flag. I don't care if 1 million people find out about it or 1 or 2, right? Because at some point, we are going to reach that new normal. It's just going to be another business.
Yep.
It's just going to be another adult use product, right? I hope we all live to see that day, yes?
Yes, absolutely. I think we're all co-creating it, and trying to do that.
I want to get one last plug in for your Cannabis Advancement Series
Yes.
and where they can find out more information about it.
Thank you. Yeah, cannabisadvancementseries.org. You can find out about our next event. It's on August 22nd in Lynn, Massachusetts. It'll be around cannabis cultivation, extraction best practices. It'll be a really cool event, more like a mixer networking event where we're going to invite some key experts in cultivation, extraction, ancillary businesses in the cannabis industry, so everything from like insurance to HR, media, so we hope you'll be there, marketing, etc. We'll have 3 breakout rooms where interested B2B, business to business, business to consumer, just anybody generally interested in the industry can come and have access to ask questions to different experts in 3 different areas. Again, free event. We have to give a big shout out to media at Joint Venture and Co. JVCO.com.
That's right. And I see Dr. Eric Ruby's here and Beth
Yes.
Doster here.
So thank you very much for having us
As
on.
always, guys, and I so appreciate you coming out on a nighttime, prime time, and we're just going to keep it going.
Yep. Quickly, thank you, Jimmy Young. Thank you, Pro Cannabis Media.
Yes,
thank you,
thank
Performer.com, for making veterans a focus you have. And lastly, a shameless plug. I love you, Olivia. I love you, Abby. Love you, Jessica, and my family. So that's
Shameless.
doing my job.
Those are the right people.
Plug
to
to
be
the family,
plugging, too.
right?
All right.
Revolutionary Clinics is just one of 49 medical cannabis dispensaries in Massachusetts, but there's a reason why it's one of the most popular. It's their patient-first philosophy. All day long, they teach, they educate, they communicate about this complicated plant called cannabis sativa. That's true whether you visit their Cambridge location in Fresh Pond at 110 Fawcett Street or at 67 Broadway in Somerville. Revolutionary Clinics, where the patient comes first. In the Weeds with Jimmy Young is a video podcast produced by the Pro Cannabis Media Network for the entertainment and education of our audience. All opinions on this show should not be considered medical advice or reflect the opinions of the management of CLNS Media, C-Suite Network, Pro Cannabis Media Group, or its marketing partners.